Hi there, this is Dr. John Carazella, and I wanted to talk to you for a few minutes about thyroid. Thyroid is probably one of the most undertreated things out there. I see so many people on a day-to-day basis that come into my office complaining of any number of thyroid symptoms. Their hair is falling out, their skin is dry, they can't think straight, their brain is cloudy, they're tired all the time, they want to take a nap at 3 o'clock in the afternoon, their skin is dry, their skin is cracking, their nails are cracking, and I can go on and on and on. But thyroid is a very common problem. In fact, Synthroid, or a synthetic thyroid product, is always in the top 5 of #1 prescribed pharmaceuticals in the United States. Why is that? It's because people have thyroid problems. Well, I'm here to suggest that I think that it's even more undertreated than what the reality suggests. That is, many people will go into their doctor and say, "Doc, I think there's something wrong. I don't feel good." And then they'll list some of the thyroid symptoms. Well, of course, the doctor's going to get a blood test, and the blood test is going to come back, and it's going to say, "Nope, your thyroid is fine." What's going on there? The doctor is not necessarily listening to the patient and his symptoms. He's treating a blood test. And that's a big problem. Well, why is that? Well, in medical school, we're kind of taught to treat normal and abnormal, but the reality is, very early on in medical school, when I went into my physical diagnosis class, they said, listen to the patient, and they will tell you what is wrong. So that the way it's supposed to go is you're supposed to listen to the symptoms, then come up with a presumptive diagnosis and confirm it with the laboratory. And the lab doesn't always tell you the story. For example, imagine a lock and a key. So a hormone is like a key and a receptor on a cell that imparts that action to the cell and causes an effect. That is, makes you less tired, makes your hair grow better. That key comes along and plugs into the lock and turns it open. Well, if that lock gets dirty or contaminated from whatever reason, and in the human body it can be toxicity, it can be inflammation, it can be hormones in the food we eat, it will cause that lock and key mechanism not to work as well. So therefore, the level of hormone that makes your cells respond properly may not be the level of hormones that makes your next door neighbor's cells respond properly. So therefore, we have to adjust or customize, or better yet, personalize the amount of thyroid that you get, that your body needs. That is, we will actually listen to what your body says, that is, based upon the things that you tell us when we're in the office. We'll listen to your symptoms, we'll integrate that with the level of hormone that we see on the lab test, and then we will recommend a treatment plan that's going to directly address the symptoms and not necessarily address the lab test. That's why in this office we may be making thyroid recommendations that may not necessarily agree 100% with your doctor, but I can tell you this. Everything we do in this office based upon thyroid is supported in the literature. It has good solid support, and we get results. We monitor people, we monitor the effects on their symptoms, we look for side effects, and we coordinate it with the blood work. When you do that, you're going to get a lot better patient result. You're going to get happier patients. They're going to be healthier, and they're more vital. So when we do thyroid, we want to listen to the patient, we want to measure, and we want to create a customized treatment plan that works for you. This is Dr. John Carazella from the Florida Center for Hormones and Wellness. And if you have any questions about thyroid, please give us a call.